Well, my name is Dr. Spyros Karatzas. I'm originally from Greece, Patras. I've done my dental degree at the University of Athens Dental School, where I graduated in 1990. I did my specialty training at Eastman Dental Center at the University of Rochester between 1990 and 1996, where I gained a specialty training in periodontics, and then my master's degree in dental research. In 1996, I moved to Boston in a full-time teaching position at the level of the assistant professor at Boston University, where I stayed until year 2000, doing basically clinical research, together with some basic science research as well, and teaching at the residence. In the year 2000, I moved back to Greece, doing full-time private practice with 1 day a week actually teaching at the University of Athens Dental School at the Department of Periodontology. These are two different things. The area of implantology is a rapidly evolving area and field. We have several different new techniques like growth factors and a maturation, as I said, of the techniques that we have already been using for quite a long time. That is that we have now all the evidence about every different treatment approach that we were designing back in the 90s. So now we know in detail what it works and what it doesn't work around implants. And of course, with the new armamentarium that we get day by day with growth factors from the companies and the latest evolutions, we can definitely, predictably deliver functional implants and in most of the cases, excellent aesthetics. Periodontology hasn't evolved that much. Periodontal regeneration was the big issue back in the 90s when I started my periodontal training. There is a significant advancement in some specific cases. There are other cases that we're still back in the osteosurgery. Bone grafts, guided tissue regeneration definitely has helped us and helped resolving some extremely difficult cases. However, some old periodontics is always handy to deliver health in this matter. The new evolutions we have, like is the collaboration with periodontology and basic science and general medicine. We have identified several general diseases that they affect the outcome of periodontal health and periodontal treatment, as well as the way that periodontal disease affects some general health issues. And this is the major breakthrough in the periodontal field, I believe, the last 5 or 6 years. Well, actually, what I utilize in every day is like all the results that we get, all those experiments for tissue manipulations, all the tricks that we know how to use, like our bone grafts, that it's in our armamentarium for quite a long time, but we know exactly now the indications and the contraindications of their use in the everyday practice. The most promising, I'd say, issue that we have is like the growth factors, that they are available clinically to a limited degree to us, like in our practices right now, and I believe this is going to be the future, because in the following 5 to 10 years they're going to be readily available to the practices. I mean, FDA approval and stuff like that, and the ability to use them in Europe, which is not yet commercially available, because we do have an excellent weapon in our armamentarium to achieve the perfect results in implantology. However, it's not readily available to everybody and for our everyday patient. I believe that's going to change in the future. We're going to have a lot more clinical data, because we do have the basic science data about the growth factors. We need a lot of clinical data to just make a concrete evidence about the methodology we're going to use them, because it's a new therapy and there is an evolution, a radical evolution these days. And I believe like in a few years we're going to see implantology from a completely different standpoint. Exactly as different as we see it now relatively to early 90s, where we were, as I've said in my presentation, we were going only for the like predictability of function, about success rates. We didn't care about the aesthetics at the time. Now that's given. We don't discuss about it too long. It's predictability of aesthetics. That's the key thing right now. Definitely patients are not educated enough about growth factors, especially in Europe where I practice. They are not readily available. They haven't heard about them that much, and even dentists are not very well informed about them. So then the patient is way back behind on that. What the patient is informed about are radical results. That's what they all want, and that's what they all claim every time that they come to the office. Oh, I had this friend, I had this relative that did this very fast treatment plan that it gave like immediate result, immediate loading, immediate restorations and stuff like that, which is another exciting thing in the modern implantology. We are able to deliver these kind of miracles to some certain extent, not to everybody, and that's the challenge, to somehow persuade the patient and educate them in order for them to understand the difference between different patient characteristics and different defects where we can deliver different things. They're different, you separate them. There are some patients that they really seek the best and they demand the best and they're willing to do everything. I'm talking about like the oral care standpoint to achieve the ultimate health. Now it changes between different places to the percentage of the population there that is really willing to do to go out of their way to save their teeth or to reconstruct their mouth. But you always find like excellent patients everywhere you go. The challenge is to educate your patients to have this positive approach towards dentistry and towards their oral hygiene and their oral health. Well, I'm going to present at the gIDE Institute a lecture about anterior aesthetics. I want really to give my point of view towards predictability of the aesthetic results at the end. Aesthetic results, you know, it's not always achievable in all the cases. We have to know from the beginning what the final aesthetic outcome is going to be. And then we are always predictable. We have to learn how to improve and use all the armamentarium that we have in our hands, and that's what I'm going to discuss in this lecture, in order to achieve the ultimate aesthetics, and at the same time to know from the beginning how far can we go into achieving the ultimate result. And that's going to be the topic that we're going to discuss comprehensively in a scholar way, basically. I am, in my mind, I always like to do biology, to have the biologic background for every movement I do. I spent several years of my life in a lab doing histology, a lot of animal research and a lot of histology, so I know really well histology of wound healing. And that always, you know, whatever you do, I like fantasize myself like at the tip of my blade as a cell that's seeing how things are changing back there, because I've seen that part in the microscope for quite a long time, so I can microscopically predict what's going to happen, or predict, or let's say guess what's going to happen there. And that's a key thing, and biology is always the thing that determines actually the final wound healing that we achieve actually. Well, definitely there are some not good candidates for implant placements. There are some systemic factors that they determine that. Biphosphonate is a modern medication that has really set us off a little bit. We do not really know exactly how they affect like the success of implant therapy sometimes. So, systemic factors or personal factors or anticipations from the patients are some elements that they have to be analyzed in detail, and we have to determine which are the good candidates for implant placements, and we also have to identify some patients that they are gonna only be disappointed from the treatment we can offer to them, doing our best or whatever it's feasible in the field. However, the expectations sometimes are not reasonable. We have to be able to identify. In my lecture, we discuss extensively about the anticipations of the patients and what we can offer in order to be able to deliver what we promise. Well, I have a family with two boys, two young boys at the age of 3 and 5.5. I try to get them into my way of thinking, which is like doing a lot of things out of the house, like scuba diving. Well, they're young, but they have a boat. We go sailing, or I like also skiing. I like several other things, like to do outdoors. And my big challenge now is to persuade my sons to follow me and follow my steps. I'm not sure if I'm going to promote them to go into dentistry. It's something they are going to decide themselves. However, I would like to have them like follow my steps in doing outdoor activities like hiking, skiing, scuba diving, shooting, hunting. These are things that I really like and enjoy, and I try to take advantage of every bit of my time to do them. And the challenge for me is to persuade my sons to do it so I can be with them more and more time.
For more education programs, visit the GIDE Institute at www.guidedental.com.